Hello friends, today I am going to reveal some true facts of new research in medical science. Exercise may be as effective as prescribed drugs to lower high blood pressure. But first of all, I request you to please share and subscribe my channel for getting my informative true facts videos uninterrupted. Please note that subscription of my channel is free of cost. Now, new research in medical science. Exercise may be as effective as prescribed drugs to lower high blood pressure. Exercise may be as effective as prescribed drugs to lower high blood pressures, suggested pooled analysis of the available data. In what is thought to be the first study of its kind and published online in the British Journal of Sports Medicine recently. But there are no direct head-to-head comparative trials of exercise and blood pressure lowering drugs, and the number of participants in some of the included studies were relatively a small caution the researchers. While promising, the findings would not persuade patients to ditch their blood pressure lowering drugs in favor of an exercise regimen just yet, although patients might want to boost their physical activity levels, advised the lead study other in a linked podcast. Exercise can lower systolic blood pressure. Exercise can lower systolic blood pressure, the amount of pressure in the arteries when the heart is beating and expressed as the top number in any blood pressure reading. But what is not clear is how exercise compares with blood pressure lowering drugs, of which there are several types, as no direct head-to-head clinical trials have been carried out. To get around that the researchers has pulled the data from 194 clinical trials looking at the impact of drug on lowering systolic blood pressure and 197 trials looking at the impact of structured exercise and involving a total of 39,742 people. The structured exercise was categorized as endurance to include walking, jogging, running, cycling and swimming, and high intensity interval training. Dynamic resistance to include strength training, for example, with dumbbell or kettlebells, isometric resistance such as the static push-up, that is plank, and a combination of endurance and resistance. 3 sets of analysis were done, all types of exercise compared with all classes of blood pressure lowering drugs, different types of exercise compared with different types of drugs, and different intensities of exercise compared with different drug doses. And finally, the analysis were repeated, but in a group of exercise trial that included only participants with high blood pressure, as most of these trials were of young, healthy participants with normal blood pressure. The results showed that blood pressure was lower in people treated with drugs than in those following a structured exercise program. But when analysis were restricted to those with high blood pressures, exercise seems to be just as effective as most drugs. What's more, the effectiveness of exercise increased the higher the threshold used to define high blood pressure, that is anything above 140 mmHg. The researchers also found compelling evidence. Researchers found that compelling evidence are in favor of exercise. This trend is likely to continue, say the researchers, given that major clinical practice guidelines have recently lowered the threshold for high systolic blood pressures. The researchers point out that the prescriptions of drugs to lower blood pressure have been sharply in recent years. In England alone, the number of adults prescribed them increased by 50% between 2006 and 2016. But substituting exercises for drugs may be challenging, as people with high blood pressure often have several long-term conditions. And an estimated 40% of adults in the US and many European countries are physically inactive, they say. We don't think, on the basis of our study, that patients should stop taking their medicines, says the lead doctor, Dr. Husni Nesi, Department of Health Policy, London, London School of Economics, and Political Science in the linked podcast. But we hope that our findings will inform evidence-based discussion between the clinicians and other patients, he adds. As together, doctors should be handing out prescriptions by exercise to patients with high blood pressure. There are some issues to consider, he suggests. It is one thing to recommend that physicians start prescribing exercise to their patients. Physicians start prescribing exercise to their patients, but we also need to cognizant of the resource implication and ensure that the patient that have been referred to exercise intervention can adhere to them and so really derive benefits, he emphasizes. In my next video, I will reveal some true facts of other latest in science research. Thanks.